Bianca and
Sure
John.
this is the right. Yeah.
Room 226. See right here.
Thank you.
Hi, Bianca and John. I'm Alex. I'm going to be your nurse today. I'm part of the genetics department. I hear you're looking to start a family, and I'm so glad to help you with this journey.
Thank you. I've been really nervous about coming in, but I'm really glad that we did.
All right. Before we move forward, I want to ask you a few questions about your medical history. How old are you?
I'm 36.
All right. Do you have any health problems I should be aware of?
No, not that I know of.
Do you smoke?
Yeah, about a half a pack of cigarettes a day.
All right. And do you drink?
2 to 4 glasses of wine a week.
All right, that's no problem, but when you become pregnant, smoking and drinking should be stopped, or else it could harm the baby.
Why is that?
If you proceed to smoke every day, this can cause slow growth and development of your baby. This can reduce oxygen levels, reduce blood flow to the placenta, risk of miscarriage, premature birth, and abnormalities. This can also cause long-term growth and behavioral problems, attention, learning of the baby. And say you stop smoking, and if you're surrounded by people who are smoking, this is also called secondhand smoking, which still can cause harm to the baby since you're still inhaling the smoke air. And also, if you proceed to drink alcohol while being pregnant, this can cause fetal alcohol spectrum disorder, which consequences with slow physical growth and abnormalities and mental impairments.
Oh my gosh, I didn't realize there were so many risks.
That's a lot.
I wouldn't want that to happen to my baby. I want it to grow fast and be healthy. I was doing some research, and what are those things? Tetra...
I heard on TikTok, I heard teratogens.
Yes, teratogons. Those are the things that can be harmful to your baby, just like I listed, like the smoking and the alcohol. And I would also like to mention that if you do proceed to smoke, that substance that you use, the addictive substance, it would more likely have your baby be addicted to that substance too, because they'll be used throughout your pregnancy, and if you use it later during the pregnancy because they're more developed, they can cause way more harmful effects. So it's very sure that you stay away from these harmful things.
Yeah, that's good to know. What is it about radiation that can't be? Did you hear about that? The radiation?
I think I knew about that too. I also heard that it's bad to be in polluted areas because that's also bad for the baby because I could breathe it in or something.
Yes, that's exactly right. You should avoid radiation and being in polluted areas. Now, John, do you have any health issues that I should be aware of?
Well, yes. Actually, my brother has something called sickle cell. I don't really know much about that. I know that the doctor told me that my brother has the actual disease, but I just have the trait, right?
Mm-hmm.
Yeah, but it's not active. But do you know anything?
So sickle cell is an autosomal recessive disease, and we have to check if Bianca is a carrier. So if she isn't a carrier, there's no chance that your child could get the disease, but they could have the trait. And if she does have the carrier, there is a chance that your child could get the disease. So that's going to be something that we're going to have to check over.
Okay, so if Bianca doesn't have the trait, then our child could have the trait, but they won't ever get the disease. Is that what you're saying?
Yes, that's correct. So other than sickle cell, is there anything else I should be aware of?
No, not that I'm aware of. I don't think so, right? No.
Okay, perfect. Now, Bianca, you mentioned that you were 36 years old. Having a later maternal pregnancy does come with extra risks, so I feel like we should mention that.
Oh, I didn't realize that was late for pregnancy. Are there any risks or anything I should be aware of?
No, it's not too late. I want to cover a few things so you guys can have a safe and healthy pregnancy. First, we should talk about the prenatal testing options. First, we used what's called a maternal blood analysis and then an ultrasound. It's very simple. The maternal blood analysis just checks for any proteins or birth defects and hormones in your blood, and the physical characteristics are shown through the ultrasound and also listens to your child's heartbeat.
That blood test, how are they supposed to get the blood? Do they poke it out of the baby?
Well, we won't get the blood from you, John. We'll get it from Bianca. We'll just get to do a simple blood work, and we get some blood right here, and then we get the samples and send it to the lab.
Okay, what else?
I'm glad you asked. If those shows any abnormalities, we will have to do more detailed testing, like an amniocentesis or chorionic villus sampling, or CVS. For the amniocentesis, we get a sample from the amniotic fluid, and for the CVS, we get a sample from the placenta, and this will give us more information about what's going on, but these also both carry a risk for a miscarriage.
Oh my!
I know it sounds really scary right now, but we're only going to need to do those tests if something's unusual from the previous test, so don't worry about that right now.
So what if I want to do something like IVF if I need to?
If you're looking for IVF, we can test the embryos for certain genetic diseases like sickle cell and test before they're implanted with implantation genetic diagnosis. This is only for cases involving IVF. Were you looking for something like that or going that route?
Nah.
No, I was just curious if that was an option.
Yes, that is an option, but if you're not interested, then we don't have to worry about that.
Okay, but what would happen if more abnormalities were shown?
In most of your cases, we might use a fetoscopy or an ultrafast fetal MRI. The MRI will show us a closer look at the brain tissues and development, and the fetoscopy, would be used to treat, or may even treat some fetal tissue, but I don't want you to worry about that. I just want to inform you about those really drastic cases, but let's move on.
So she has to do all of these?
No, John. Like I said, only if there's abnormalities we'll do more testing, but since she's a little older, we can do more testing just in case, just to double check.
Oh yeah, that makes it less overwhelming.
Since she's older, like you said, is there any health concerns that we need to be worried about, like nutritional things? Because I know pregnant people technically aren't supposed to eat like sushi or fish.
Or like caffeine, right?
Right.
Yeah, that's exactly right. I would recommend just stay away from fish overall, and it could be really harmful for the baby. Same with caffeine. I would recommend just at least like 1 cup a day. It's really important to go to all your prenatal appointments and just take care of yourself. Bianca's gonna gain a lot of weight, like 25 to 30 pounds. That's just general healthy range for a pregnant woman. And it's important to eat a lot of calories, like 300 extra calories.
Damn, girl, we're gonna be big back in this.
Yeah, but I won't be able to eat certain things.
Well, she is going to be eating for 2. But that's exactly right, Bianca. It's important to eat a variety of proteins, fruits, whole grains, vegetables, and important to stay away from sweets and fats and like deli meats, because that can give risk of like bacteria and listeria inside of it. And it's really important to definitely make sure you clean all your food, like especially produce. Make sure you're getting rid of that bacteria before you eat it.
So do I have to take any like vitamins or supplements?
Yes, it's important to take a lot of folic acid, as a pregnant woman is in high demand. It's a vitamin that's mineral enriched and helps with the growth and development of the fetus. You can increase your folic acid with green vegetables, citrus fruits, even egg yolks. Do you guys have any more questions while you're here today?
Oh yeah, while we were here, I wanted to bring up how I wanted to do a home birth because my mom did it and I thought it would be special.
That's so sweet. Do you want some advice on home births?
Yeah, that would be great.
Okay, so you're going to be in a lot of pain because you're not going to be able to use any medication. I would also recommend like relaxation exercises, like practicing them, like breathing exercises, possibly a doula that can help with the labor going properly and help with the fetus's physical condition when they're born. I also recommend having a nurse midwife because they can help you in case of an emergency.
Thank you for telling me this. I didn't realize how beneficial a doula would be in this process.
All right, well, I got everything that I need from you today. I hope everything goes well with what you are deciding to do. And thank you for meeting me today. If you have any questions, feel free to reach out.
Bianca, come on!
Thank you.